Doctor humiliates black nurse in front of a patient, not realizing who the patient really is. Dr. Marcus Sterling had always believed he was destined for greatness. At 35, he was the youngest department head at the Presbyterian Medical Center, with perfectly combed blonde hair, designer suits, and an ego big enough to fill the hospital. His colleagues whispered about his arrogance, but none could deny his surgical skills or his picture-perfect marriage to socialite Victoria Sterling. What they didn't know was that Marcus's perfect life was built on lies. 3 years earlier, he was just another resident drowning in student debt and working 18-hour shifts. That's when he met Keisha Williams, a brilliant, compassionate nurse working the night shift in the ICU. She was everything Marcus wasn't: humble, kind, and genuinely devoted to her patients. Their love story blossomed during quiet moments between emergencies. Keisha brought Marcus coffee during his breaks, and he shared his dreams of becoming a famous surgeon. She believed in him when no one else did, even covering his shifts when he was too exhausted to work. "You're going to change the world, Marcus," she whispered in stolen moments along empty corridors. "I can feel it." But as Marcus's career began to soar, something dark crept into his heart. The higher he climbed, the more he looked down on those who helped him get there, including Keisha. The first crack in their relationship came when Marcus was promoted to attending. Suddenly, he was too busy for coffee breaks, too important for their quiet conversations. Keisha noticed the change, but convinced herself it was the pressure of his new role. Then came the charity gala, the event that changed everything. Victoria Ashworth, daughter of pharmaceutical magnate Richard Ashworth, attended in diamonds and designer gowns. When she set her sights on the handsome young doctor, Marcus was powerless to resist, not out of love, but because she represented everything he believed he deserved: status, wealth, and a shortcut to the life he craved. That same evening, while Keisha worked a double shift comforting a sleepless pediatric patient, Marcus found her seated beside the hospital crib, quietly humming a lullaby. "We need to talk," he said coldly, not even glancing at the sleeping child. Keisha looked up, her dark eyes tired yet still full of love. "What's wrong, sweetie? You seem upset." "This isn't working anymore," Marcus said, his words cutting through the silence like a scalpel. "We're on different levels now. I need someone who matches my ambition." Keisha's eyes filled with immediate, crushing pain. "Marcus, what are you saying? After everything we've been through? I'm marrying Victoria Ashworth in 6 months. I think it would be best if you transferred departments. Or better yet, hospitals." Keisha slowly rose, her hands trembling. "So you're throwing away 3 years for money and status?" "I'm choosing my future," he replied, already walking away. "You should too." 2 years later, Marcus married Victoria in a wedding featured in society pages, with a country club reception and a Maldivian honeymoon. Her father used his connections to accelerate Marcus's career, and before long he was running his own department. Meanwhile, Keisha remained at the Presbyterian Medical Center, transferred to the emergency department. She threw herself into her work, becoming known for exceptional compassion and the ability to calm even the most difficult patients. Nurses respected her, residents relied on her knowledge, but Marcus barely acknowledged her presence. Until one day everything changed. On a hectic Tuesday afternoon, paramedics wheeled in an unconscious elderly black woman, well-dressed, wearing fine jewelry and a designer coat. "What do we have?" Marcus asked, barely glancing at her. 72-year-old female, found unconscious at home. "Possible stroke or cardiac event," the paramedic replied. Keisha immediately assessed her vitals and prepared her for tests, working with practiced efficiency. "BP 180/110, pulse irregular," she reported professionally. Marcus looked dismissively at the monitors. "Probably another case of medication non-compliance. These people never follow instructions." Keisha's hands paused, her jaw tightened at the careless racism, but she continued her assessment. Doctor, I think we need a full cardiac workup. Something's off, she said calmly, masking her anger. Marcus sneered loud enough for others to hear. Nurse Williams, I don't need medical advice from someone whose greatest accomplishment is learning to take blood pressure. Maybe if you'd gone to med school instead of settling for a nursing degree, you'd know the difference between intuition and a real diagnosis. The ER fell silent. Residents exchanged uneasy glances. A middle-aged man in the next bed watched, anger growing. Keisha remained professional, though her hands trembled. I understand you're the doctor, but I've been at this for 8 years. I believe this patient urgently needs care. What you believe doesn't matter, Marcus snapped. You're here to follow orders, not give them. If you can't handle it, maybe consider another career. I hear housekeeping is hiring. His words hung poisonous. Tears welled in Keisha's eyes, but she held them back. I'll continue assessing the patient, she said quietly, maintaining her dignity. That's when the man in the next bed, filled with rage, spoke up. Excuse me, doctor, did I just hear you speak to that nurse like that? Marcus spun around, annoyed. Sir, please mind your own business. This is a medical matter. It's absolutely my business, the man said firmly. Especially when I see a healthcare worker treated like trash in front of patients. The man reached into his wallet and pulled out a card. My name is Judge William Patterson, he said, voice resonating with authority. I serve on the hospital's medical board and I've been observing this disgraceful display. Marcus's face drained of color. Judge Patterson was one of the city's most respected figures, known for fairness and integrity. Judge Patterson, I wasn't aware, Marcus stammered. No, you weren't aware, the judge cut in. You weren't aware you were being watched. But more importantly, you didn't realize the unconscious woman you dismissed so flippantly is my wife, Dorothy Patterson. Silence filled the room. Marcus felt the ground collapse beneath him. That's right, continued the judge. The woman you lumped in with those people is not only my wife of 45 years, but the former head nurse of this very hospital. She dedicated 30 years of her life to patient care here before retiring. Keisha's eyes widened. She had heard legends about Dorothy Patterson, the nurse who trained dozens of current staff. She's been experiencing chest pain for weeks, the judge explained. Her regular physician dismissed it. Ring any bells, Dr. Sterling? Marcus gaped wordlessly. Judge Patterson, he started. Save it, interrupted the judge. You humiliated a dedicated nurse, made racist comments about my wife, and your arrogance nearly cost her life. Keisha remained focused. Judge Patterson, has your wife had recent fatigue, shortness of breath, or chest pain? Yes, he said, concern replacing anger. She insisted something was wrong. Keisha checked the monitor. Dr. Sterling, look at the ST elevation in leads 2, 3 and AVF. Marcus reluctantly looked. His face drained white. That indicates an inferior wall myocardial infarction. Your wife is having a heart attack, Keisha said gently. She needs to be sent to the cath lab immediately. The next hour was full of urgency. Dorothy Patterson was rushed to the cardiac catheterization lab, where the cardiology team confirmed Keisha's suspicions. She had indeed suffered a massive heart attack. The swift intervention saved her life, but the damage to Marcus's career was only just beginning. Judge Patterson remained at the hospital throughout his wife's procedure, and word of the incident spread quickly through the medical center. By the time Dorothy stabilized and began to recover, Marcus was summoned to an emergency meeting with the hospital administrator. Dr. Sterling, said Administrator Janet Chen as Marcus entered her office, I've received deeply troubling reports about the incident in the emergency room today. Marcus had spent the last few hours trying to come up with an explanation, but facing Chen's stern expression, his carefully rehearsed words fell apart. There was a misunderstanding, he began weakly. A misunderstanding? Chen's voice was icy. I've read accounts of you making racist remarks about a patient, belittling a respected nurse in front of staff and patients, and nearly missing a life-threatening diagnosis because of your bias and arrogance. I was having a bad day, Marcus tried again. Work stress. Dr. Sterling, Judge Patterson is on our medical board. His wife is a beloved former colleague. And the nurse you demeaned, Keisha Williams, is one of our most respected employees. She literally saved Mrs. Patterson's life while you were too busy being cruel to notice she was dying. The weight of his actions finally hit Marcus. What happens now? You are suspended pending a full investigation, Chen said firmly. Judge Patterson is demanding your immediate termination, and frankly, I'm inclined to agree. Your behavior today violated every standard this hospital stands for. As news of Marcus's suspension spread, other stories surfaced. Nurses shared accounts of his condescending manner, residents reported his dismissive attitude toward their concerns, and patients complained about his lack of empathy. Victoria Sterling, Marcus's wife, heard about the incident through her social network before Marcus could explain it himself. When he returned home that evening, she was waiting for him in the marble foyer, arms crossed. I had a very interesting phone call today, she said in a dangerously calm voice. Judge Patterson's wife personally called me to discuss your behavior at the hospital. Marcus's stomach sank. Dorothy Patterson had clearly recovered quickly from surgery and wasted no time expressing her feelings. Victoria, I can explain. Explain what, Marcus? That you're a racist? That you humiliated a nurse trying to save a patient's life? That you're so arrogant you nearly let a woman die because you couldn't bother listening to someone you think is beneath you? It's not that simple, Marcus protested, but even to himself, the words rang hollow. It is exactly that simple, Victoria replied. My father built his reputation on integrity and respect. Do you think he'll stand by someone who behaves like this? Do you think I will? The next few weeks were a nightmare for Marcus. The hospital's investigation confirmed the accounts of his conduct, and Judge Patterson used his influence to ensure the story spread through the medical community. Marcus's surgical privileges were revoked, and he was officially terminated from Presbyterian Medical Center. His marriage to Victoria dissolved as quickly as his career. She filed for divorce, citing irreconcilable differences, and her father made it clear Marcus would never work in any hospital affiliated with their pharmaceutical network. 6 months after the incident, Marcus was working at a small clinic in a rural town, his medical career in ruins. The house he once shared with Victoria was gone, sold to pay legal fees. His reputation followed him everywhere, making it impossible to find work at any prestigious hospital. Meanwhile, Keisha Williams thrived. Grateful for her life-saving intervention, Judge Patterson nominated her for an award in nursing excellence. She was also accepted into a nurse practitioner program, with the Pattersons quietly funding her education. Dorothy Patterson made a full recovery and became something of an advocate for nurses at the hospital. She worked with the administration to implement new policies to protect staff from harassment and discrimination. One evening, Marcus swallowed his pride and called Keisha. It was the first time they had spoken since that terrible day in the ER. Keisha, he said when she answered, his voice barely audible. I know I have no right to call you, but I need to say something. There was a long pause before she responded. I'm listening. I'm sorry, he said, and for the first time in years, he meant it. I'm sorry for how I treated you, for what I said, for throwing away what we had. I'm sorry for who I became. Keisha was silent for a long time. When she finally spoke, her voice was soft but firm. Marcus, I accept your apology, but you need to understand something. The man you became didn't appear overnight. The seeds of that cruelty were always there. Success just gave them room to grow. I know, he admitted. I've had a lot of time to think about who I really am, and I don't like what I see. The good news is, you can change, Keisha said. But not for me, not for your career, not for anyone's approval. You have to change for yourself, because it's the right thing to do. 5 years after the incident that shattered his life, Marcus Sterling worked as a family doctor at a small-town clinic. He made a fraction of what he once earned, lived in a modest apartment, and drove a 10-year-old car. But for the first time in years, he looked in the mirror and didn't hate what he saw. He spent his evenings volunteering at a free clinic, treating patients who couldn't afford healthcare. He learned their names, listened to their stories, and slowly began to understand what it truly meant to be a doctor. Keisha Williams completed her nurse practitioner program and worked at a community health center, serving underserved populations. She never married but was surrounded by colleagues who respected her and patients who loved her. Dorothy and Judge Patterson established a scholarship fund in her name for minority nursing students. She often spoke at medical conferences about the importance of treating all healthcare workers with dignity and respect. One day, Marcus received a letter in the mail. It was from Dorothy Patterson, written in her elegant handwriting. "Dr. Sterling," it read, "I've been following your work at the rural clinic through mutual colleagues. I want you to know that I see the changes you've made and respect the man you're becoming. True redemption isn't about returning to who you were, but becoming who you were always meant to be. The patients you serve now are lucky to have you." Marcus read the letter 3 times, tears streaming down his face. It wasn't forgiveness, he knew he didn't deserve that. But it was something even more precious, the knowledge that people can change, that mistakes don't have to define a person forever. He folded the letter carefully and placed it in his desk drawer, next to his medical license. Every morning when he came to work, he saw it there, reminding him of who he once was, and who he was still becoming. The story of Dr. Marcus Sterling wasn't about redemption earned through grand gestures or dramatic moments. It was about the quiet, daily effort of a man learning to be better, one patient at a time, one day at a time. And somewhere in the city, Keisha Williams continued her work, saving lives and touching hearts, just as she always had. She never needed to be humbled, because she never forgot that true strength comes from lifting others up, not tearing them down. This tangled love story was never really about love, it was about power, prejudice, and the cost of losing your humanity. But in the end, it became something else entirely, a reminder that it's never too late to find your way back to the person you were meant to be. The end.